Third cranial nerve is oculomotor nerve. Oculomotor nerve, which supply most of the muscles of the eye, extraocular and intraocular muscles. It includes two components: somatic efferent and general visceral efferent. The somatic efferent include the main oculomotor nucleus. This nucleus supply the levator, palpebrae, superioris, and superior rectus, medial rectus, inferior rectus, inferior oblique. The general visceral efferent supply intraocular muscle, which include the constrictor pupil and ciliary muscle. The main oculomotor nucleus or the oculomotor nucleus located in the midbrain. Here, located in the midbrain. Where in the midbrain? At the level of superior colliculus, in the gray matter which surrounded the cerebral aqueduct. This is the location of the oculomotor nucleus. The oculomotor nucleus receives information from the cerebral cortex through the corticonuclear fiber, and the oculomotor nucleus connected to the trochlear, Ptosis, and vestibulocochlear nerve through the medial longitudinal fasciculus. The parasympathetic nucleus of oculomotor nerve, or Edinger Westphal nucleus, is located just posterior to the main oculomotor nucleus. The axon of Edinger Westphal nucleus is preganglionic parasympathetic fiber, which pass with the oculomotor nerve and synapse with the ciliary ganglia. The postganglionic fiber reach the constrictor pupillae and ciliary muscle through the short accessory nerve. The oculomotor nucleus leave the anterior aspect of the midbrain through the interpendicular fossa and then pass in the middle cranial fossa in the lateral wall of cavernous sinuses, where it divides in superior and inferior division. It enters the orbit through the superior orbit fissure. The superior branch supply Levator, palpebrae, superioris, this one, and superior rectus, while the inferior branch supplies the inferior rectus, medial rectus, and inferior oblique. So the oculomotor nerve supply intraocular and extraocular muscle except the lateral rectus and superior oblique. Lesion of the oculomotor nerve. It supplies Levator palpebrae superioris. So this muscle cannot act during the lesion of the oculomotor nerve, and the patient cannot able to elevate the upper eyelid, and this lead to ptosis. Ptosis means dropping of upper eyelids. It also supplies the constrictor pupillae, so the pupil is dilated at C on the left pupil of this patient, the lower patient. It supplies extraocular muscle except the lateral rectus and superior oblique. So this muscle pull the eyelid, the eyeball, laterally and inferior laterally. Important note, there is incomplete ptosis because we have other part of Levator palpebrae superioris, which is supplied by sympathetic innervation. As you see, in this patient has oculomotor palsy. There is a partial ptosis, dilatation of pupil, the eyeball pull laterally and inferior laterally due to the active of the lateral rectus and superior oblique muscle. Cranial nerve number 4 includes the trochlear nerve. The trochlear nerve has only one component, which is somatic efferent. It includes one nucleus, trochlear nucleus, which is supply the superior oblique muscle. This nucleus located also in the midbrain, in the gray matter surrounded, in the anterior part of the gray matter surrounded the cerebral aqueduct, but at the level of inferior colliculus. The trochlear nerve is the only nerve leaves the brain stem through the posterior aspect. It leaves the midbrain at below the inferior colliculus. The oculomotor nucleus receives corticonuclear fiber from the post-cerebral hemisphere and also connects to the 3rd, 6th, and 8th cranial nerve by medial longitudinal fasciculus. This nerve, as I mentioned, it leaves the posterior aspect of the midbrain at the level of inferior colliculus, then run in the middle cranial fossa, and then through the cavernous sinuses, it enters the orbit through the superior orbit fissure. It supply one muscle, include the superior oblique muscle. This superior oblique muscle turns the eyeball inferior laterally. So, if the patient has a lesion of the trochlear nerve, the patient has difficulty in turning the eyeball downward and laterally. Cranial nerve number 6, Ptosis nerve, also has only one component, which is somatic efferent. This nerve supply one muscle, includes the lateral rectus muscle. The Ptosis nucleus located in the bones near the floors of the fourth ventricle, beneath the facial colliculus. In the posterior aspect of the bones, there is the facial colliculus. This facial colliculus formed by the nucleus of the Ptosis nerve and the axon of facial nerve. The Ptosis nucleus receive corticonuclear fiber from both cerebral hemisphere and connected to the third, fourth, and eighth cranial nerve by medial longitudinal fasciculus. This nerve leaves the pontomedullary junction and then run in the middle cranial fossa and then through the cavernous sinuses. It enters the orbit through the superior orbit fissure to supply one of extraocular muscle known as lateral rectus. If the patient has a lesion of the Ptosis nerve, this patient, the eyeball is pulled medially by the medial rectus muscle. And the eyeball cannot move laterally due to the injury of Ptosis nerve. That is all. Here is a summary of the cranial nerve number 3, 4, and 6. The third cranial nerve, oculomotor nerve, through the superior and inferior division, is supplied Levator, palpebrae, superioris, superior rectus, medial rectus, and inferior rectus. The inferior and inferior oblique. The lateral rectus supplied by the Ptosis nerve. The superior oblique, here the superior oblique muscle, this one, superior oblique supplied by trochlear nerve.